what is the connection between maternal dietary habits and childhood obesity? Well, for starters, the most obvious connection is the fact that if a mother has poor dietary habits, it's likely that her children also will have poor nutritional habits, which can put them at risk for childhood obesity. And while this is probably the most important connection, this isn't the only connection. It has become increasingly apparent that a mother's perinatal dietary habits, that is, what she eats during pregnancy, also plays a crucial role in promoting childhood obesity. For a long time, we've known that mothers that are undernourished put their babies at risk in many ways. Whether they're undernourished because of a micronutrient deficiency, which is a deficiency of vitamins or minerals, or because of a macronutrient deficiency, which is lacking protein, carbohydrates, or fat, both can lead to fetal growth retardation, which results in a low birth weight baby. When babies are born underweight, the phenomenon of catch-up growth takes place, which basically means that babies grow rapidly during their first few months of life. Ultimately, being born small and having to catch up has an effect that programs those babies and puts them at increased risk for obesity later in life. But that's not the only effect that deficiencies can have. Micronutrient deficiencies have also been shown to have an adverse role in the formation of the fetus's fat cells as well as their lipid metabolism, further putting them at risk for childhood obesity. In addition, micronutrient deficiencies are also associated with higher levels of leptin. Leptin is a satiety hormone, which makes you stop eating, and thus you'd think that having excess leptin might sound like a good thing. The reality is that when excess leptin is present in the body becomes resistant to it, meaning that it no longer responds to its appetite-suppressing effects, and thus, without this stop eating signal, you have an increased risk for obesity. Back to macronutrient deficiencies for a moment. It's important to note that if a mother doesn't consume at least 1,500 calories every day, she is unable to produce an adequate amount of breast milk to feed her child. And of course, this would result in the mother having to rely on formula to feed her child. Numerous studies have conclusively shown that formula feeding is associated with an increased risk for obesity. The last deficiency that can increase risk for childhood obesity is an inadequate intake of omega-3 fatty acids. Now, there is still some debate here regarding whether it's the excess omega-6s or lack of omega-3s that are present in the current North American diet, but the point is, essential fatty acids are an important constituent of breast milk. If they're lacking in the mother's diet, that means they'll also be lacking in the mother's milk. And it's been shown that omega-3s play a crucial role in programming the fetus's metabolism, and thus can put children at higher risk for obesity. Now on the flip side, mothers that are overnourished also put their fetuses at risk. For starters, it's quite clear that maternal obesity is a major risk factor for childhood obesity. This is a pressing issue as 2/3 of pregnant women are overweight or obese. Part of the reason for this increased risk, aside from, of course, the obvious contextual factors, is that mothers who are obese are less likely to breastfeed, and thus are more reliant on formula, which increases their child's risk for obesity. In addition, maternal obesity is also associated with an increased risk for a low birth weight, which, as explained earlier, leads to catch-up growth. What often goes hand in hand with maternal obesity is things like type 2 diabetes, as well as gestational diabetes, which is the onset of diabetes only during pregnancy. It's important to note that the prevalence of gestational diabetes is rapidly increasing. From 1994 to 2002, prevalence doubled, and currently, between 2 to 10% of all pregnant women will develop gestational diabetes during their pregnancy. What's significant about this is the fact that babies who are born to mothers with these conditions have been shown to have a reduced sensitivity to leptin and insulin, both of which are satiety hormones that tell the body when it's full. So clearly, this can lead to an increased appetite and thus childhood obesity. Of course, there's also the issue of excess weight gain during pregnancy. Almost 40% of women gain too much weight during pregnancy. This is harmful because it can lead to a high birth weight baby, which increases risk for childhood obesity. What I also really want to emphasize is that irrespective of weight, A mother's dietary habits play a key role in programming their child's risk for obesity. There is tremendous evidence from studies done on animals which show that a high-fat diet during pregnancy is a key factor for increasing risk. Furthermore, what's important to note is that on average, North American pregnant women are at the upper limit for fat consumption, according to North American recommendations. However, according to European recommendations, which are a little bit lower, North American pregnant women are consuming too much fat. The reason fat is a problem is because fat passes freely through the placenta. So, when a mother consumes a high-fat diet, her baby is exposed to more fat. And what has been seen in animals is that fat plays a key role in genetic programming. Having excess fat has been shown to increase insulin resistance, as well as increasing the formation of fat cells in the fetus, both of which, of course, lead to childhood obesity. And lastly, there was a great rat study done where they gave pregnant rats open access to a junk food diet rich in fat, salt, and sugar. And of course, compared to control, they found that the babies born to the rats who ate the junk food diet had a stronger preference and appetite for junk food, which of course increased their risk for childhood obesity. And this is supported by loads of research, which shows that taste preferences are formed in utero. Thus, whatever foods a mother exposes their child to while they're pregnant, as well as when they're breastfeeding, will make those children develop a preference and liking for those foods. So, if we're rearing babies on ice cream and fast food, there's a good chance they'll be hooked on these foods for life. Is there a connection between maternal dietary habits and childhood obesity? Well, the fact is, there are many. If we really want to prevent childhood obesity, we need to take a look at maternal dietary habits, because it's now clear that a child's risk for obesity is being established before they're even born.